Hi, Mr. Jones. I'm Macy, and I'm going to be your nurse today. We're going to be putting in a catheter. I've identified my patient by his name and his date of birth. We've already rolled up his gown, washed our hands, put on clean gloves, and we've done his pericare and made sure he's dry. Now we're going to open our kit, opening away from us first, touching only the 1-inch unsterile border. Now we're going to take our gloves and put them over here, and we're going to open them. Again, only touching the 1-inch unsterile border. We're going to pick it straight up. We're going to slide it on our hand, not touching the outside. We're going to grab this one by the cuff and pick it straight up. And slide our hand in. Now we're going to come over here. We're going to pick up this drape. And we're going to put it shiny side down underneath our patient. And now we're going to take this drape and put it over the penis in a swift motion, making sure we don't touch him. And now we're going to get our kit ready. First, we're going to open our lubricant, put it in our tray, we're going to throw it away. And then we are going to get our alcohol swabs ready, open those, and put them in the tray. And then we're going to attach our syringe to the balloon part of the catheter to get it ready. And then we're going to put the catheter tip into the lubricant. It would normally have a sheath on it, and I would wrap it in my hands as it would come out so we can maintain sterility. So I'll put this in my lubricant. And then I would explain to my patient that he's going to feel some pressure. And then I would grab the penis at a 90-degree angle, take one alcohol swab and wipe around the external meatus one rotation and throw it away. I would do that again a little farther down on the penis. And this is my non-dominant hand, so I grab the penis with this hand so I can maintain sterility with my dominant hand. And then I grab my last alcohol swab and I go a little bit farther down on the penis and I throw it away. And then after this, I'm going to ask my patient to bear down like they're trying to void. And then I'm going to grab the catheter. And for males, I'm going to insert it 7 to 9 inches, and for females, it is 2 to 3. So I'm going to insert it. I ask him to bear down and just take deep breaths. And we keep inserting until we get a urinary return. And that's how we know we're in the bladder. Once we're in the bladder, we're going to grab the tip of the catheter with our non-dominant hand, and we're going to inflate the balloon. 5 to 10 milliliters, it says on this port here, and we have a syringe of 10 milliliters. We're just going to insert this slowly, not too quickly, so it doesn't burst. And the balloon is what anchors the catheter in the bladder, so it doesn't come out.
Make sure you say that you raise the head to your eye and that you can lower the side rail to.
So once I have all of my solution in there, I'm going to unattach the syringe, put it in the casing. I'm going to give it a gentle tug to make sure it is in bladder. Next, we're going to maybe clean up around his peri area, make sure he's comfortable. Wipe his leg and take the catheter with some slack so it's not too tight and stat lock it to the patient's leg. And after this, we're going to take our catheter bag and put it on an immovable part of the bed. And after this, we would clean up all of our stuff, leave him in a comfortable position with the bed low, give him anything he needs, and just throw all of our stuff away. So when we come back, well, first we would put the bed rail up whenever we leave. And then when we come back, we're gonna take this bag, empty it so we can take the output. And whenever I document my catheter, I would put the time, the amount of the solution I put into the balloon, so the nurse would know how much to take out when she comes back. So we take this bag, empty it out into a graduated cylinder, and record the output. And then we would put our catheter bag in here. So once we would be done, we would just take off our sterile gloves and wash our hands. And then we would come back, wash our hands, put on clean gloves, and do the output and things like that. And then maybe wash our hands again, put on clean gloves, and then get ready to take it out. So we would explain to our patient that this is normally a harmless procedure. They feel very little pain, maybe just a little pressure. We're gonna have them sit in supine position. I would get all my things ready. So I would, again, take it off the bed rail, take the output, and then take the stat lock off my patient's leg, make sure there's no skin irritation or anything like that. And then I would clean up my patient before I take out his catheter. And then I would get ready to deflate the balloon, again with clean gloves, and I would insert the syringe and allow it naturally flow out over 15 to 30 seconds. And if it doesn't come out, then we would just gently pull back on the syringe. And before I would take this out, I would look in the EHR to make sure how much the previous nurse put in to the balloon, so I would know how much I need to get out. All right, we have all of our 10 milliliters. And then also before we do any of this, we might put a waterproof pad underneath the patient. And then we're gonna have the patient just relax, tell them that they might not feel anything. And then we're going to pinch the catheter and pull it out in one swift motion, just like that. And then we would dispose of this. And then we would leave our patient in a comfortable position. We would clean him all up, clean his peri area, let him know that we would need to monitor his output for the next 24 hours. Get him anything he needs, like his call light, a blanket maybe, and maybe a bedside commode or anything he needs to get to the bathroom. So then we would put up his bed rail, we would take off our gloves and wash our hands, and that's how we do a catheter.